In other taxpayer-financed, government-run healthcare systems, affordability, access, and quality do not go together. Care gets rationed when demand outstrips supply. It will here too. Last year, physicians across Canada reported wait times much longer than in the US.
Access is worse here in the United States already. The percentage of people reporting a cost barrier accessing healthcare is about 33% in the United States compared to an average of about 13% across 9 national health systems. In Washington state, in the graphic down below, the more people that are unable to see the doctor because of the cost, the higher the mortality rate is in that county. Care already gets rationed, and wait times are already fairly mid in the United States. Now, for elective surgery, the United States does really well. The United States has pretty low wait times. However, they're not so much lower than the countries with universal healthcare programs like the UK, like Germany. The United States actually has terrible wait times for general practitioner appointments. All we need to do to fix the supply and demand ratio that Elizabeth brought up is to get more doctors. If we do that, then we won't run into the problem you can see Canada has here, which is that they have too few doctors, and thus their wait times are too long. Healthcare performance compared to spending, you can see the United States is absolutely horrible. We have the lowest health system performance, and we spend the most money. Canada is always used as the counterexample, and that's because Canada is the next worse on this chart. However, if you look at cost-related access problems affecting populations, you can see that in the United States, 50% of lower income people and 27% of higher income people reported cost access barriers. If you compare that to the low performing Canada, you can see 21% of the lower income people, which is lower than our higher income people, reported cost barriers.